Premier Oscar Mabuyane will hand over the last batch of the NHI clinics in the King Sabatha Dalindyebo Municipality. The 2 clinics will be handed over today at Luthubeni and Gengqe in Mqanduli, while 2 more will be handed over on Friday. Let's cross live now to our colleague Atule Joka. Atule, a very good morning to you. What's happening where you are?
Good morning, Desiree. Well, I can tell you we are waiting for the Deputy Minister of Health, Dr. Phaahla, to come and officially open this Luthubeni clinic. It is part of the 4 last batch of clinics that will be open here in the OR Tambo district. As we know that the OR Tambo district was declared as one of the disaster poor areas, so it was selected as one of the areas that will be used as a pilot projects for the NHI project. So this area is also in the peripheral areas of the Eastern Cape. It's one of the older clinics that were dilapidated, that people were struggling to access a quality healthcare. So he will be here to officially open this clinic. We do know that the National Health Insurance does come to these peripheral areas to sort of provide people with quality healthcare despite their socio-economic status. 4 other clinics were opened in Ngobo, in Lusigisigi and in Mthatha. So this is the last 4 batch of clinics. They will be open between today and tomorrow. Dr. Phaahla will be making his way, but he hasn't arrived yet. So we are here, we are waiting for them. Well, we've been engaging with people on various spheres. When we go to these villages, they are quite elated, they're excited because the status of the clinics that they used to access healthcare in were very dilapidated. There were mud structures, they did not have waiting rooms. They would say that when it's cold, they will be sitting outside. Some were prefab structures. They were struggling to get access to medicine. There was shortage of staff. So this NHI project is there to sort of try and avert those challenges, to sort of try and alleviate those challenges here in the rural areas. So Luthubeni will be the first one to be open in the last 4 batch of clinics that will be open here in the OR Tambo district, which was determined as the pilot district. We do know that also the National Assembly is moving around the province to also conduct public hearings on this National Health Insurance. We do know that some people have criticized the National Health Insurance, saying, of course, who will foot the bill, which is the big question. But I can tell you, with people in the rural areas, they are very excited, they are elated to be able to access these quality healthcare services, despite their socio-economic status, despite their standing in society. Desiree.
Atule, you've touched on it a bit, but just delve deeper into the impacts of the other clinics that have already been opened. Is there any measurable impact that we've been able to observe so far?
Well, so far, I can tell you now that these clinics comply with the NHI standards. So they have to have medicine, they have to have doctors on site and other services. But I can tell you the one in Lusigisigi was the only one which was fully fledged, which was fully compliant with NHI standards. It had an optometry section, it had a dentistry, it had a physiotherapy section, it was a 24-hour 7 maternity ward and a dispensary section as well. So people do have access to those quality healthcare services. But I guess with time we will be able to determine if some of those challenges were averted, especially the issue of the shortage of staff in these clinics. Desiree.
So what's the full program for today when the minister arrives?
The full program here today, we are standing at the clinic, but just adjacent to this clinic, a stone throw away, there is a tent there is a marquee. They will be going there, they will address the community to sort of provide them with information of how this will work and how they can lay their complaints if it does not meet their standards. And then from then they will come here. If my colleague can pan just a bit and zoom in, there is a ribbon there that will be cut by Dr. Phaahla when he comes here later on in the day. So they will move from that venue to come here and cut the ribbon to officially hand over this clinic to the locals here. So that's the program as we understand at this moment, Desiree.
Atule, thank you so much for talking to us this morning. As you can see, the NHI is becoming reality, going beyond just being a conversation.